Good morning, everyone. I want to thank you so much for coming to our Food Policy for Breakfast seminar series. I want to welcome you to Hunter College, New York City Food Policy Center's online panel discussion. My name is Charles Platkin, and I'm the Executive Director of the Center and also a nutrition professor at Hunter College. We are very fortunate to have several experts join us today to discuss measuring food insecurity. Our panelists include Dr. Chris Barrett, a professor of applied economics and management at Cornell University's Charles H. Dyson School of Applied Economics and Management, and co-editor-in-chief of the academic journal Food Policy. Joel Berg, CEO of Hunger Free America. Dr. Carlo Cafiero, the project manager of Voices of the Hungry and senior statistician at the Food and Agriculture Organization of the United Nations. Dr. Alisha Coleman-Jensen, a social science analyst at the USDA's Economic Research Service, and Dr. Trenor, a physician, business leader, entrepreneur, and the founder and CEO of Socially Determined. I want to thank you all for joining us today. I would like to start by having each one of our esteemed panelists give a very brief introduction of their unique background and their association with food insecurity measurement. Let's start with Dr. Barrett, please.
Yeah, thanks so much for having me, Charles. It's a pleasure to be with such an esteemed group today. I'm Chris Barrett. I'm a professor at Cornell. I'm an economist, in particular an agricultural and development economist. My research program surrounds how to reduce unnecessary human suffering, of which food insecurity is one of the most prominent in the world today. So I've spent some time thinking about and working on how to measure food insecurity. Pleasure to be with you all.
Thank you. And next, Joel. Can't hear you, Joel.
Man, rookie mistake. This is Joel Berg. I'm CEO of Hunger Free America. I've been with the organization for 20 years. Before that, I worked for 8 years at the U.S. Department of Agriculture. While I had nothing to do with the creation of the original food security measurement system, I had a fair amount to do with the original announcement of it. And for the decades since, I've worked very closely with the measure to inform policymakers and the media.
Thank you. And Carlo?
And good morning, good afternoon, good evening, everyone. I'm Carlo Cafiero. I'm an economist also by training, but since 2010, I'm working for the Food and Agriculture Organization. So I turned a statistician, and I am in charge of food security and nutrition statistics at the Statistics Division of FAO. And my responsibility includes being the focal point for the global monitoring of food insecurity under the Sustainable Development Goal agenda. Thank you for having me here today.
Thank you so much. Alisha?
Thank you, Charles, and thank you for inviting me to join you today for this discussion. My name is Alisha Coleman-Jensen, and I am a sociologist at the Economic Research Service of USDA. I lead our annual report, Household Food Security in the United States, and I also do a lot of measurement and data work around food security, as well as other research on the determinants and outcomes of food insecurity, mostly in the United States. Thank you.
Thank you. And Trenor, Dr. Williams?
Thanks so much, Charles. I appreciate it. Trenor Williams, by background, I'm a family physician. I'm the CEO and co-founder of Socially Determined. We're a healthcare analytics company. Part of what we do is measure social risk, including food insecurity, housing instability, as part of that, both in a community and a person level. Also by background, I'm the son of a social worker and the son of a restaurant owner. So I call my dad a social worker as well. I grew up working in his restaurant since I was 12. So it's great to be here with you all today.
And you're also a former medical director at a ski resort, right? I did my research.
You did your research. Yeah, it was not the worst job that I've ever had in Mammoth Lake, California. That is true.
And last but not least, my co-host, Alexina.
Good morning, everyone. I'm Alexina Cafiero. I'm the Deputy Director at the Hunter College New York City Food Policy Center. Thank you to all our panelists for being here today, and thank you all for attending.
Thank you so much. So I want to jump right in here. I think I would like to start with a quick definition of food security and food insecurity, just for framing, and also because my belief, and you'll correct me if I'm wrong, please, is that you need to have I think you need to have a definition in order to be able to have measurement. So I'm going to read the USDA definitions. Food security for a household means access by all members at all times to enough food for an active, healthy life. Food security includes, at a minimum, the ready availability of nutritionally adequate and safe foods, assured ability to acquire acceptable foods in socially acceptable ways. And then there's parentheses added by USDA. And that says, that is without resorting to emergency food supplies, scavenging, stealing, or other coping strategies. Okay, that was USDA has that in there. And food insecurity is the limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. I'm going to open it up to the panel. Thoughts? You all agree with that definition? Joel, jump in, Joel.
I'll just say those are definitions for society as a whole. There are slightly different definitions for household food security versus household food insecurity. And let me just say this, I spent decades unsuccessfully trying to explain to my late mother what food insecurity meant. Why don't you just call it hunger? And I was trying to explain to her that it was a really useful mechanism to have to be able to distinguish between the type of mass famine we still see in some developing countries and the food hardship, food rationing that we see more commonly in some developed countries. I say some because the US, by most accounts, and there's no great international methodology, but most accounts has far more per capita food insecurity than virtually any other developed Western democracy. So as speaking of democracy, as Churchill said about democracy, it's the worst system except all others. And I think that's the same about the food security definitions and really the food security measurement. It's imperfect by many ways, as we'll discuss today, but I still think it's more effective than any of the alternatives in really helping people understand the nuances of what it means to lack sufficient purchasing power for food in a country that is otherwise very wealthy.
And does anybody else please jump in? I mean, are we getting everything in that definition? Would you rewrite it? Are we all set with it?
I think, if I may, Charles, in the definition that you read, yes, you have everything. But to have everything, it becomes a nightmare for the measurement, for the assessment, because then the question becomes how many different things you want to measure and what do you really need to make a comprehensive reporting on all these nuances. So I agree, it's a very important, useful, complete definition to describe what we intend, but it becomes a nightmare the moment in which we want to communicate statistics, numbers, assessment to make sure that they don't get misinterpreted. And I think one of the things that we just heard from Joel is that food insecurity and hunger might be synonymous. Well, I think that is a problem because we might want to have an ability to differentiate on the severity level of the condition. So not all food insecure people are alike, and there are very different extent of problem and solutions depending on how severe is this inability to access food.
Can I just quickly respond? Go ahead.
Can I jump in here? This is Alisha from ERS. I want to piggyback on what Joel and Carlo said. As Joel mentioned, these are sort of the conceptual definitions of food insecurity from the Life Science Research Office. And we know that we're not measuring all of those things. For example, acquiring foods in socially acceptable ways, that early on in the measurement of food insecurity, it was determined that some of those factors didn't sort of fit the measurement model well. And so we kind of pared it down to have a stronger measure. So operationally, what the USDA food security measure is measuring is being unable to acquire adequate food for one or household members because they had insufficient money and other resources for food. So we're just kind of measuring that more limited definition, as Carlo mentioned, that we need to, have a strong measurement model that covers what we believe we can measure well.
I just add that in the first decade of the food insecurity measurement, or much of the first decade, there was a subset of food insecurity described as hunger. And so USDA basically said there's food insecurity, then the more severe subset of it is hunger. And what George W. Bush's administration did, and Alisha's great predecessor, Mark Nord, was blamed for this when he had nothing to do with it. People, many pay grades above him did it, but basically stopped using the word hunger, and instead you use the term very low food security. Now, many of us advocates at the time opposed that, and we thought that was a way of sort of minimizing hunger in America. The irony is, the real world result is it accomplished the opposite, because the federal government no longer officially uses hunger as a subset of food insecurity. That made it easier for people to lump together hunger and food insecurity as one term. So the attempt to minimize it by some policymakers ended up doing the reverse, allowing people to basically say hunger and food insecurity are equivalent when really they're not.
And if I can maybe jump in, I completely agree with the core points that have been made. It's important to keep in mind that most things we really care about from a policy perspective, reducing poverty, improving sustainability, boosting resilience, reducing food insecurity, these are really important concepts, but as Alisha said, they're just concepts. And it's very hard to operationalize complicated concepts. And therefore, it's crucial to have multiple measures, because almost never can you come up with one measure that will encompass all of these things. As Carlo said, it's a nightmare. There's so many different definitions, so many different components to the definition, rather. It's very hard to capture them all in any different data collection instrument, and especially any single numeric measure. So just as one example, one of the crucial parts of this definition that has long gone overlooked is the active and healthy life piece. So we developed measures that were promulgated in a time when our primary concern was undernutrition, that people were getting insufficient access to essential macronutrients, calories and protein. But today, worldwide, that's not the main problem, and it's not the main problem in the United States. The main malnutrition problems are obesity and micronutrient deficiencies. Far more people in the world suffer from those sources of encroachment on the ability to lead an active and healthy life. But we have trouble measuring that in the conventional measures established for this purpose. That's not that the measures are flawed, it's that no measure is up to the full task of capturing the full definition. We've got some very good measures, but we need supplementary measures, and we have to track multiple things at once, because you manage to what you measure. And when we don't bother to track the things that matter to an active and healthy life, when we don't bother to check whether really all people at all times have access to such food, that's when we can inadvertently start developing policies that are really tailored to just a narrow part of that quite laudable definition.
Thank you, Trenor, and then I want to move to talking about measurement.
Yeah, maybe just two quick points. One is just to respond to Chris. I so agree. I was going to add the idea of nutrition security. People like Michelle Nushan and Wholesome Wave, right, would expand the definition. So we're just talking about the definition, expand that to be add nutrition, so healthy options, right, as part of overall food insecurity. The other thing that this makes me think about is the time component to food insecurity, right? So some people, unfortunately, are food insecure for months, if not years on end. And some people, it is a very small defined time. So when we think about it, we actually think about risk of food insecurity. So I think about it at a community level based on the availability of affordable and healthy food options. So based on where I live, do I have risk of having food insecurity because I don't have good options available to me? At the person level, I think about my own risk. So based now on my own financial situation, number of people in my household, other factors, am I at risk for being food insecure? And it may be that I'm on SNAP, and in the 4th week of the month, I may, again, be at risk. And that third piece is social needs. So if social risk is, again, my risk of being food insecure, it's in that defined period of time. So maybe in that last 30 days, when I've actually transitioned from being at risk to having needs. And to me, as we think about the measurement and the definition of food insecurity, understanding that time continuum and that sort of that process that somebody goes through on a weekly, monthly, on a yearly basis becomes really important in terms of how we think about defining it. And then, of course, how we think about addressing food insecurity.
Thank you. So I want to also, segue over to measurement. And I guess, could someone please quickly describe how we're measuring currently with the USDA standard questionnaire? How are those actually conducted? Maybe Alisha?
Sure. I can jump in, or it could be a test for someone else. I can see how well we explain it. So we measure food security annually. It's part of the current population survey. So the food security supplement is in addition to the current population survey, and it's added every December. The current population survey is also the source of poverty and unemployment statistics for the United States. So the food security supplement includes a series of 18 questions about food security. 10 are about the household as a whole and adults in the household. And then 8 questions are about children for households with children. It's based on an underlying measurement model, the Roche model, which I'm not going to go into detail, but we can talk about if people are interested. But we sum the number of affirmative responses to the item. So if people say that, yes, that happened to me, or sometimes often that's true. And 3 or more affirmative responses classify a household as food insecure, and then 6 or more is very low food security for households without children, and 8 or more is very low food security for households with children. And then we also have separate measures for food insecurity among children that rely just on those 8 food security items for children.
And are we doing this through phone calls, through social media?
Yes.
Yeah. Sorry.
So it's a phone survey. It's also conducted in person for a portion of the sample. And it's a high quality survey. It's conducted by the Census Bureau. It tends to have pretty high response rates. During the recession, the response rate for the survey fell below 80% for the current population survey, which was the first time. So there's a really high response rate. And if there's a concerted effort to get a full representative sample of the United States included in the sample.
And do they talk about using other means to try to capture information? I saw a study about using social media, and was surprised at the response. I think they put out 250,000 advertisements, and they got responses about 7,000 to a survey. Of course, when you dig deeper, it was only white people that responded, white females. So certainly not capturing everything correctly, but again, certainly worth discussing and thinking about. Just wanted to throw that out there. And other ways of measurement that any of our other panelists think might help advance or assist with this, unless it's not a problem.
If I may, Charles, I do have something to add. And one thing is that we should probably be careful not to confound 2 very different aspects. One is being able to capture the real reference population, which has to do with the way in which you design your survey, the instrument that you use. But another thing is whether you're measuring the right thing on the people that you happen to reach. And so I think it's important to keep them separate. Because too often I see overall criticism of, for example, using phone call, but is not related to the food security measurement. It applies to everything that you can measure by asking questions to people. Or somebody criticize the approach that is based on this question by being subjective or based on people perception only because you ask people to respond to a question. But if we go in that direction, we should realize that every survey is always conducted by asking people to report something. Labor survey, how many hours did you work last week? It's an opinion? No, it's a fact that is reported by people. So I think the method, the approach that Alisha described is probably, yes, the best existing way of getting to the relevant information on people's ability to access food in a very simple way. The alternative would be trying to see what people actually eat, but collecting data on actual food consumption, it's tremendously costly, very imprecise despite of what people think, unless you do it in an almost an experimental basis. So definitely, I think of the various alternatives that have been tested over the years, the experience-based approach is the best one we have.
So let me jump in and start the conversation with what you just said, because that was excellent. But I think that, so we'll divide it into approach and measure and what we're measuring. But I guess what struck me, and there are two reasons for this whole panel discussion. One is a conversation where I was incredibly frustrated and called Joel, which I always do when I'm frustrated around food insecurity.
Thank you.
And I said, Joel, shouldn't we be measuring this every single month? And we need to have some. This is ridiculous that we don't have this data, real time. And he calmed me down and said, maybe not every month. And I asked what the cost would be and how we would do it. And that was a brief conversation. And I've been thinking about it ever since. And then the other was hearing, Dr. Williams talk with Jim McGovern. I get that right, Congressman? And thinking, wow, maybe there's something we're missing here. Maybe there's a sort of an algorithm in connection with measurement tools that should be being used. And again, I'm a neophyte in this area, so I'll leave it to you all to come up. Alexina, am I getting all that right? Okay.
Yeah, I think so.
So Charles, maybe just to respond there as part of that, and I think about what I'm going to suggest in no way is a replacement for surveys or the individual conversations that we have, either from a USDA standpoint or as a family doc or a care manager. And I apologize, I put a healthcare lens on a lot of things, and not all of this is about healthcare, but it's the world that I know as part of that. So just for context, when we measure, and every day we measure food insecurity, the risk of food insecurity at a community level, we use hundreds of different data elements, a lot of that tied to the assets and attributes of a given community. So we think about, are there unhealthy food options around? Are there healthy food options? How close do people live to a full service grocery store? And I think that's part that we don't get from a survey, right? Understanding the assets that are available in any given community. Are they culturally sensitive? All of those components. And then when I think about at a person level, the ability to integrate information related to income, number of household members, how much disposable. So we actually calculate after housing costs, how much additional money people have every single month. What percent of their income goes towards rent? And part of the converse of that is how much do they have left over? Do they own a car? Do they live in an area with a viable transportation network? All of those things come into play when we start to think about food insecurity. And again, this is not a replacement. It's an additive to thinking about surveys and the individual connection, but it allows people like us literally in days for some of the, and we work only in healthcare, but to work with healthcare providers and maybe do 3 million people in 3 days and say, who is at the most elevated risk for food insecurity? And that allows organizations to think about, with that measurement tool, where maybe do they go to have those detailed conversations when we can help identify around somebody what those risks look like. So just a thought.
And I just want to jump in and add to pile that on. And again, I don't know enough to be critical. Okay, I'm just throwing out my questions when I sit there every day. I don't understand when I go through the surveys, and maybe I'm missing something. There's no discussion about nutritious food. The definition seems strong, but maybe I'm missing something in the surveys, but I didn't see those questions that connect to the definition. Again, I might be missing it. It's not like I've studied it. You guys are in this all the time. And then I'll open, I think, Chris, someone was about to talk. I'm sorry.
Yeah, the point I was going to make is, you talk about algorithms, Charles, and my research group is working with data scientists here at Cornell and working with folks elsewhere. We've been trying to use machine learning methods to predict malnutrition indicators around the world, not less in the United States, it's incredibly difficult. So we're making progress really quickly on trying to develop good methods for predicting where you could target. And I think a crucial part of the last comment was really these are most useful for identifying subpopulations at risk so that we can focus attention in a particular place or a particular type of household, because you necessarily can't measure people's status using the sorts of data streams that we feed into machine learning algorithms. But let me underscore two things on that. The first is we don't yet have predictive skill. So
You just went on mute, Chris.
So we can't predict. I was going to say there are two key pieces here. The first is we can't predict malnutrition indicators with much skill at all anywhere in the world right now using the sorts of data streams that we typically try to use for this. We're getting reasonably good at predicting poverty, by the way, but we're not yet very good at predicting malnutrition or any other correlate of food insecurity beyond poverty. And the second crucial point is you can't do machine learning without survey data because we need something that we train the models on. So the hope is that what we can do is fill in the gaps between high quality survey data so that you have greater spatiotemporal coverage. You cover all the periods between expensive surveys. You cover the communities you didn't survey because you can project from the places you carefully measured using conventional methods, you can project into the rest of the population. That's the promise of machine learning. It's not as a substitute for conventional clinical or survey-based measurement. It's as a complement to it to enable us to better target interventions, especially to target them on a near real-time basis, because you simply can't mount high-quality, large-scale surveys quickly and inexpensively to respond to emerging problems. It's exceedingly difficult to do. The promise of machine learning is we could leverage existing data to potentially predict those at risk in places on a near real-time basis, but we're not there yet. That's very much a research agenda.
I should add my response to Charles about how much it would cost to do this. The second half of this is I'd rather use that to reduce the problem than just further measure it. And at some point that is a trade-off. That being said, I think all of you are aware, since the pandemic started, the federal government, not USDA, but certainly consulting with USDA, did start measuring monthly food hardship through the Household Pulse Survey. And in the next few weeks, we're going to release our National Hunger Atlas, and we're going to compare that data to the SNAP increases nationwide and state by state, and show correlation, although we can't prove causation yet, but very strong correlation between exactly when the SNAP benefits increased dramatically, there was a significant decrease in food hardship. I should also add that, again, I said no measures are better than this, but there's no question to me that the federal measure is undercounting food hardship. And I just say two points. Number one is when you use census data, particularly American Community Survey, to ask how many people are getting SNAP benefits, food stamps benefits, the number of people who self-report that is dramatically lower than the caseload data. And we know from a legal basis, the caseload data is very, very close to 99 to 99.9% accurate, because that's what government payments are based on, number one. Number two, a colleague of mine, I forget who, at a ERS conference actually a decade ago, read off the questions in the food security questionnaire, particularly for those with children, and compared those to questions that a child protective worker would ask from a government child welfare agency about whether the family would lose custody of their child because of neglect. And they were very similar. So to put that in English, if you're admitting that to the government that your child is going hungry or skipping meals, you could be admitting that under other government definitions, you are an unfit parent. So it shouldn't be shocking that a lot of people are not admitting to government, question takers, why this is a problem in their lives. Again, I don't have an alternative Those are just par for the course in trying to ask anyone, particularly low-income people, about their lives. And more people may not be answering and may not answering truthfully. As you see, exit polls are decreasing in reliability because people are not answering truthfully about how they just acted minutes ago.
Right. And the other, and that's really valuable information. And I know when I was getting my PhD, I took a course in social work, and many of the social workers said that in interviews, if a person admitted to smoking pot, this is like 100 years ago, casually, that they would basically, send child protective services to their house, even in a casual, so, and I was shocked. So yes, I think that that's a major issue. But I don't want, and again, I want to hear everybody's voice here, but I don't want to forget this whole concept of are the surveys that we're using, relying on, should they have circumstantial questioning around food access, nutritious foods, and am I missing that it's already there? So I'll throw it back out and you can discuss.
If I may,
yeah.
Charles, I mean, I feel compelled to interject by saying that the tendency of wanting to have on a single measure everything under the sun is too much. And as we started saying, we should also respect the need that a measure is associated with a very narrow and specific concept. And the concept that the USDA scale capture is ability to access food. It's not telling us which food actually every individual or a household is accessing. It's not telling whether the individual or the household is actually malnourished or not, and in which form, but is what it is. It's measuring the ability to access food. Then this alone obviously cannot be used to target an individual household, because that would be probably a mistake. You will be risking of misclassifying a single household if only based on the food security measure, but it's extremely helpful as a way of getting towards understanding why. But you need to do this association, this studies, and the severity of food insecurity measured with this tool has been proven to be a very good predictor of the presence of various forms of malnutrition. I think the work that Rafael Perez Escamilla at Yale has done over the year is very important in order to demonstrate, for example, that obesity and other diseases that are associated with excess food consumption are actually the result of food insecurity, simply because you don't have the ability to continuously accessing quality food. So the answer should be to integrating as many simple measures as possible of the different aspects of this poverty, access to food, malnutrition chain of events, so that this can be studied and lead to better predictive models like Chris was mentioning. But we cannot pretend that with a single measure you can capture all these things. It will be a mistake. It will be confusing thing rather than shedding light on it.
Right, and as Chris, Dr. Barrett explains, that these aren't competitive concerns. Am I getting that right? And I agree. And I'm not trying to bring them up as competitive. Just that, the definition. I was surprised at how I felt very comfortable with it. Okay, but then when I look at the measurements, it didn't correspond. So maybe there's some additional measures that should be added separate from that. And that's really what I was getting at, that maybe we're not measuring everything we should be. And that was it. And again, triggered by, what Dr. Williams's whole platform is, and what Dr. Barrett was talking about using algorithms. And I'm not talking about right here, right now, but I'm talking about, we need to have direction and goals and objectives. And is that something that we need to look at it for the future, again, to advance this and to have, the elected officials that are listening and the staff or government staffers and community-based organizations and so forth that are on this, webinar. Is there a message there that, yes, we should be thinking about this and we should be thinking, or, hey, it's hard enough to get this, let's just stick to this, it's helping us. That's kind of what I'm getting at.
I think one important, sorry, go ahead, Alisha.
Thanks. So just to jump in there, the food security measure is not a detailed measure of nutritional intake. It's just not. It's meant to measure if people are able to get enough to eat. And we do have questions about, for example, balanced meals or relying on low-cost foods. It's really hard to ask people about nutrition, even like dietary recalls aren't, exact. Studies have shown that the food security measure is correlated with nutritional outcomes and food purchases, and also, a slew of health outcomes, from chronic disease to, children's educational outcomes to sleep patterns and all of these things, so that we know that the food security measure, even though it's not asking detailed questions about nutrition, we know that it's related to diseases that are related to nutrition, like diabetes. And it's related to other health outcomes, and it's related to food purchasing patterns. So I think that the fact that it's been sort of grounded in all of this research literature suggests that its strength and its validity across these things.
And then moving along to frequency, because again, I can't help myself. I'll say it, like when you talk about saying balanced meals. When I have a class of nutrition students that are even graduate students, and I say, what's a balanced meal? And even when I went out to experts like T. Colin Campbell, and I think I went out to 6th Marion Nessel, and I could show the list of what is considered, quote, healthy eating or balanced eating. There's a wide variety of responses. And again, this is a discussion. I'm not criticizing, I'm just telling you like the things that go through my mind. So moving to, unless you want to respond to that, I wanted to move to frequency.
I'll just mention quickly. So you're right. I mean, the balanced meals measure, I think from the beginning, was sort of recognized as maybe one of the weaker items in the food security module, because it's not well defined and everyone has a different idea of what a balanced meal is. We did cognitive testing of the full food security supplement in 2019 with the Census Bureau, when we tested an alternative question around healthy meals. And there's also no consensus around what a healthy meal is. And for balanced meal, people at least kind of could say, well, it means a variety of things, or eating, more than just, potato chips or something. People got the concept that it was about a variety of foods, eating different things. Healthy meals, some people talked about not being able to afford to buy organic foods or name brand foods, which is not what we're trying to capture with the food security module. So I agree that there's not a definition of balanced meals, but there's not really a consensus definition of healthy or nutritious either. So it's really difficult.
I'll throw out a dirty one that we use, which is just, do you have access to fruits and vegetables? I mean, just internally. That's
Charles, there is research ongoing on trying to get to a simple, sufficiently easy measure of dietary quality that you could inform with a short questionnaire, going along the line of what you just say, asking people if they eat fresh fruit and vegetables and a few other sentinel kind of food, but it's still very experimental. But I think it's important to recognize, on one hand, what are you measuring and how good is what you're measuring for the purpose at hand. Definitely the food security scale is not measuring the quality of the food. You cannot do it by asking nutritionists, don't do it. But
I think it's important to note this because, Carlo,
exactly.
I think it's important to note this because I think, and that's one of the reasons for this panel discussion, because there's so much criticism. And I think we need to sort of talk about this so that, that it's not just in our world. Look, we did a quick survey, not a quick survey, a painstaking survey in East Harlem and the Upper East Side about just the term food insecurity. And nobody in East Harlem, or very few people in East Harlem actually knew what that even meant. Okay, they thought it was something about food safety. Okay, so meaning getting sick from food. So whereas the Upper East Side, the numbers were very high about understanding food insecurity. So just to clarify, so this is about clarification and understanding, so that we can move forward on this. And Alec, Joel, you wanted to say something?
Yeah, I just want to say, I think it's important to move beyond what I think is a pretty simplistic understanding of this is either good food or bad food, a good meal or a bad meal. I think we need to look at things in context of at least a week at a time, as well as portion size, not just food choice. And that most of us knowingly have a less nutritious meal once in a while, if we have a balanced life, and then eat healthier food other times. That's number one. Number two, there are very complex reasons I don't think social science fully understands: economic reasons, emotional reasons, physiological reasons, cultural reasons, built environment reasons why people do or do not eat foods at any particular time. From the hunger realm, we tend to think of this from an economic perspective. Many of us either stridently or try to subtly or respectfully push back against some from the public health field, who sometimes imply it's all about personal choice and all about willpower, and frankly have some really class-based and racially freighted language about people making bad choices. And that's why we freak out when people want to say, oh, people who get SNAP should never be able to use it for a soda, when the tens of millions of wealthy people who are overweight and get subsidized by the government with Medicare and corn syrup subsidies can drink whatever they want. But I think we really need a more nuanced understanding of how all these factors impact food choice. But just say, when we at Hunger Free America, we ran a community-supported agriculture fresh produce distribution program in very low-income neighborhoods of New York, and we had a waiting list for it. So we believe the evidence is clear. If you build it, they will come. If you make healthier food affordable, convenient, and physically available, low-income people will eat it. It's not what even the lowest income, least educated people don't know an apple is healthier than a soda. There's much more complexity to it than that.
Alexina?
Yeah, I have a question kind of in this same train of thought. A recent report from the USDA on food insecurity in the United States in 2020 found that, I quote, an estimated 89.5% of US households were food secure throughout the entire year in 2020, with access at all times to enough food for an active, healthy life for all household members. Something about this strikes me as not completely accurate, because we know how many households and individuals had to rely on food pantries and other forms of emergency food to feed their families. Should food insecurity estimates distinguish between households that are able to purchase their own food and those who have to rely on emergency food networks to feed their families? And I ask that not to not give credit to how much work was done at food pantries to keep people fed. It's so important. But when we think of designing interventions to combat food insecurity and keep throwing money at emergency food because we think people are fed, rather than focusing on a livable wage or expanded SNAP benefits or incentive programs, it just seems like we're not capturing something there. And maybe I'm wrong, but I thought I'd really like to throw that out there to you all.
No, it's an excellent question. I thought it
Yeah, Alexina, you're exactly right. That keep in mind, it's not that the number is wrong. So Alisha and her team are the ones who generate those numbers from the December CPS module. It's your thinking of agency. Do people on their own have the ability to go out and buy the diet that leads them to live an active and healthy life? But the measures aren't designed to get at those agency questions. So they're accurate reports, but they're necessarily the cumulative effect of not just the food pantries, which did heroic work, but also the expanded free breakfast and lunch programs, the fact that SNAP was expanded, that unemployment benefits were expanded, that rent moratoria meant people could forego paying rent and invest in food. And we can't parse out all those things. We don't know which of the many different tools governments and communities employed in the United States to respond to the massive sudden threat to food security that so many households face. We have no idea which of those tools had which share of this effect. the wonderful news is that cumulatively, we didn't have this huge spike in people not being able to get enough food. But your instinct is exactly right. Many of them had to do it through ways that they found humbling, that they found unreliable, and we should not be in that situation. And in many ways, this just represents what happens in much of the world. The strange thing in the United States is we're not used to it, but many communities around the world, that is part of at least seasonal existence, if not everyday existence. And getting at these agency questions, people's ability to, on their own, command an adequate, healthy diet, that's kind of the next frontier. But Carlo and Alisha spend more time thinking about these measurement questions than I do. I haven't figured out yet how you get at that in the sorts of survey questions that are practically implementable.
But in a way,
So Carlo and Alisha, I have a question on top of this. I know you have a comment, Carlo, but
no, it was just
for the
to follow up
500
on
people,
this.
for the 500, and so people that are on this webinar right now, Alisha, Carlo, what would you change if no one would, if irrespective of your job and employment, would you change anything on these surveys that we currently using? They're used around the world. They're very powerful. Is there anything that you would change, that you could say that you wish this was there, or you wish this, or you wish people would know? I think we're getting to some of that, which is that this is just measuring one thing, and you need to relax. Again, I'm paraphrasing, in Charles speak, and you need to relax about all these other measurements. They're not part of this, and we only can measure one thing. And you could, like most people, can only do one thing well. We're only measuring one thing here. That's it. If we need to measure other things, that's a whole nother story. Am I getting that right?
Okay, I will start, Alisha, and then you can give your perspective. I think we need to confront the fact that generating evidence and information is costly, and somebody has to bear that cost. And it's not by pretending to do things that you solve the problem. So we do what we can with the information that can be reasonably generated as frequently as possible. You were touching on the issue of frequency, but that's again, who is to take on the responsibility to conduct more than one survey during the year to do this? So as far as the food security measurement is concerned, this can be improved. The methodology allows for testing additional questions and see whether they belong to the same scale. And just the example that Alexina made is very important. It was part of the initial concept of acquiring food in socially acceptable ways. And so if you have to do recourse to a food pantry or charity, that might be, shameful. And it was tested. And for example, in Mexico, there are cases in which they still ask that question. But the fact that the analysis of the data through the Rush model, which is fundamental, reveals that those answers are picking something else, which is not the same concept of severity of food insecurity, tell us something important. So what is the future? The future might be to have a multidimensional measure in which the agency and ability to access are captured in two dimensions that do not necessarily overlap. And as Chris said, this is for the future. It's something that we try whenever we have a research opportunity, but we are not there yet. Okay. What we have is very good for what it is, if well understood, and can be used and should be used in any study that tries to understand why people are or not food insecure.
What about frequency? Unless, Alisha, you had a comment that you wanted to add.
But you need to have more than one survey. If you want to know how frequent is a situation, you have to repeat the survey, but it's not just for food security.
Right, but we're talking about the possibilities for New York City having a more frequent survey, right? And not only using survey information, but also using, data like what Dr. Williams is doing in Socially Determined, and looking at a host of things to come up with, to come up with a way of targeting food insecurity for those community-based organizations, for the city to be able to intervene in a better, more efficient way, and get right to the point when there are issues like what happened with COVID-19. Looking at food pantry lines, perhaps, and food pantry, usage, if that increases, coming up with different measurements aside from just survey data. Again, I think the objective is to try to advance our thinking here, and Joel says maybe we should measure it every quarter. Right? Am I putting words in your mouth, Joel, or we had that discussion?
Depends. Again, some of you know NIH has asked for detailed recommendations on how they should better study hunger, food insecurity, nutrition security. And my very top response is, don't give the impression we don't know what causes it and what solves it. Right? And the most important thing is to spend money on doing what we know solves it, which is making healthier food more available, more physically convenient, and more physically available and affordable. So it would depend on the cost. Certainly the unemployment rate we have on a monthly basis, that and earnings are a pretty darn good proxy for food insecurity. Not exactly, but if map the meal gap methodology of Feeding America, they've used other proxies for food insecurity. So there are other things that are already collected by the government on a monthly basis that we can use to make pretty good estimates, that we don't have to spend a lot of money, with a specific food insecurity, a question. Don't get me wrong. I'm probably one of the world's top consumers of Alisha's products and every one of the other research. So I live and die on this research, but at some point I go with Dr. King's quote of not being bogged down in the paralysis of analysis.
Right, but again, and there's lots of questions, and we'll get to them in 2 seconds. But shouldn't we ask food pantries if there's an uptick? I mean, I just want to throw that out that no one needs to respond. Chris,
they will almost always say there is, and we can discuss that another time. I think that's probably one of the least accurate measurements.
Okay, good. Thank you. Trenor, then Chris.
Yeah, I wanted to get, even as if we think about expanding it, and again, I'm a hammer and everything's a nail, so everything to me is about healthcare, and there've been a couple of people that have talked about the relationship between food insecurity and health. But when I think about the opportunities for access, and I think about, Carlo, you talked about cost, right? As we are redesigning healthcare reimbursement in this country, both from a Medicaid, a Medicare Advantage, potentially for Medicare, right? We're thinking about actually reimbursing around interventions that address food insecurity. And when I think about asking these hard questions of people who are vulnerable, right? Trust is one of the most important commodities, right? That we think about when we do that. And I'm not suggesting just because I'm a family doc that physicians always have trust with their patients. But when I think about social workers and care managers and physicians and care teams that are part of that, I believe that there's an opportunity from an access standpoint and from a cost reimbursement standpoint to include the healthcare community in the assessment and understanding of people's food insecurity, how they're addressing that at a person level, how it impacts their health and their healthcare journey. As part of that, we've started to integrate that into whether CMMI is part of CMS and different survey questions, right, that are part of that. So I think as we think about both the content of the questions and whether and how, Charles, to your point, that expands, and we think about nutrition and other factors, leveraging the access and potentially the financial model that exists within healthcare may give us an opportunity to get much greater input directly from people and have a better strategy related to interventions. So just a thought.
Chris, you had a comment?
Yeah, I was smiling because when Joel says we know what causes it and focuses on it's the availability of healthy, inexpensive food, that's a supply side explanation, and that is very much part of it. But forgive me, maybe this is the researcher in me. We don't have nearly as strong a command of what instruments we can use to improve food security as we would like, because we know it's supply side, we know it's the things Joel is talking about, but it is also the demand side. I would personally speculate that the strongest features driving the food insecurity rate in 2020 in the United States that actually had it tick down rather than up in the midst of a horrific pandemic and economic disruption were rent moratorium and increased unemployment benefits. It was the fact that people had discretionary income to spend on food that they otherwise usually wouldn't, because none of us compartmentalizes our food expenditures apart from our payments for lodging or healthcare. It is all blended together. There are a lot of things we need for a healthy and active life. I mean, having a good diet but winding up homeless is obviously not a good alternative. We don't see those go together frequently. So we need to focus on having people have livable incomes. That is a crucial part that must go with a healthy and ample food supply to keep food prices low. If we just push people's incomes, but we don't boost the supply of healthy foods in neighborhoods where people enjoy income growth, we just fuel food price inflation, and people still can't afford a healthy diet. So you need both. You walk on two legs. It's both the demand and the supply side. We have a very hard time separating them out analytically, probably because we need to work on both at the same time, not just food availability, but at least as much people's ability to command a decent diet on their own, the agency question, which is partly about incomes.
Carlo, just because we're running out of time, you had a question or comment?
I was just and unfortunately I get interrupted for a moment. I want to reinforce one thing that Joel said, that engaging the healthcare community in providing information, also engaging the education system, the schools, because teachers also have a direct connection with the children and they can detect phenomena that might be associated with poverty and food insecurity in a way that could be leveraged. This is true in Europe. I'm not so familiar with the US primary education system, but I think that schools are also a potentially source of information, not from survey, that can shed the light.
So I want to wrap up, because I do always promise our audience will wrap up exactly on time. And here's what I'd like to sum up for each of you. If you could just give me in one or two sentences. Alexina and I in the center, we're advocates. We talk to a lot of advocates. What should we be advocating for around measurement? Okay, and what in a sentence or two, what should we be advocating for? Alisha, I'll start with you. Around food insecurity measurement.
Right, that's a difficult question. I mean, I think for me, the where the food security measurement is lacking, we've talked about this, and this is related to sort of current conversations around nutrition security. We just don't have good survey-based measures of nutritional quality that are efficient and don't have too much burden for respondents, and that give an accurate measure of nutritional quality. I don't think that should replace the food security measure, but I think that would be a great addition, and something that could be asked in conjunction, because we know that there are some people who may not be food insecure in terms of resource constrained food insecurity, but might have poor nutrition for other reasons. And to be able to ask about both those things jointly would be a potential advantage.
Thank you. And Chris, in two sentences?
Yeah, I think that as Carlo's been emphasizing, we need to be careful about trying to cram everything into single measures. We triangulate. We need multiple measures. As Alisha's emphasizing, it's really hard to get at quality of diet questions. That's an area of frontier research that needs to complement rather than replace the existing measures. And adding an agency is another area, but these are going to be complements. We're not going to bundle it all into a single thing. That's just likely infeasible.
We have 1 minute left, so we really need only a sentence. So Trenor, sorry.
Two things. One is I think we have to look at the supply side, like Charles said. I think we need to understand resources, food resources, healthy options that are available to people. And we have to be able to take advantage of the unbelievable data that we have about communities, about populations, and about individuals as we think about this.
And Joel?
I just
5
agree with
words?
Chris. Just agree with Chris. We have to look at this in the broader context of people's entire household budget. And that includes cash they get and benefits they get and expenses they have to pay. And that's all got to be basic math to help people afford healthier food.
And Carlo, wrapping it up?
To me, that the food security measurement that exists is used as widely as possible by all many people, is not abused, is not. So communicating about what exactly is and promoting its use in the context of studies that complement with other information so that we can understand the chain of effects.
Fantastic. Well, and that really does help because I think I learned a lot, and I want to thank you all again for being here today. I thank you all for coming together, especially with all of your incredible busy schedules. And you all said quick yeses, and I completely appreciate that. And it was a fascinating talk, and I really believe this will advance thinking around this topic. Please make sure to check out nycfoodpolicy.org. Make sure to sign up for our weekly news digest, which we work painstakingly to make sure we have accurate and strong information for everybody each week, with also research studies. Thank you. Stay safe and healthy. And again, thank you to all of our panelists. Stay well.
Thank you.
Thank you.
Thanks,
Bye
folks.
all.